So with that, I want to introduce Tim Stevens. It's been a great honor to introduce him because he's been an integral part of One Health Academy for a long time. He says he stumbled into public health for the last 30 years, but I think that's a great thing. Public health has benefited from it. Last 15 years, he's really been focused on biodefense and infectious disease policy, and he's president of Prospero Analytics and CEO of Ballpark. So I'm going to introduce Tim, and I'm sure he'll walk us through the exciting world of flu.
Thank you very much. Well, did I need to do anything?
Nope.
Respect to. All right. So we're also on the web. So I may repeat your questions, but I may also ask those of you that are asking questions to speak up because I couldn't hear you from different parts of the room. So it's interesting, as we did our introductions, we connected a little bit to some of the things that we know about flu, but another title that the great influenza, the 19N influenza, has had over the years, that it was forgotten in some respects. So I want to explore that with you as well, and I'm going to force you to participate whether you want to or not, because I really think, and David being here is a reminder of that there are plenty of things that we assume we know as scientists, and I am not a scientist, but there are methodological and there are understandings of the use of data. I want to challenge us, though, to also think about how do we understand our history and what are the methodological assumptions in that, because I do think when you go back and look at the first draft of history, which is what I've been doing for the last, what would that be, 70, 80 days now, since January 1, that there are things that we can understand, but I think we can only understand them what they mean for driving some of our perceptions, as we still deal with influenza as a likely disease for us to be concerned about with it as a pandemic. We have to start discussing what are our perceptual and our understandings of history as well. So that'll be the basis of what I'm going to talk about. I can't start, though, or I did, but I shouldn't have, without acknowledging that the person in this room, Jessica Taffy, who introduced herself, is also being an integral part of the project that we're doing. And then I'll ask you now, has anyone been reading on an irregular basis, the 1 day at a time posting on influenza? Does anyone know the hell I'm talking about? No. Okay, so the reason I'm in front of you, I think, other than Will thinking I'm lovely, first time I've been introduced that way. Thank you. Well, that was nice. Because I'm sure there are people who would challenge that description as well. So since January 1, at Prospero Analytics site, you can see a posting of a influenza-related article from from that day 100 years ago in the American press. Who on a regular basis reads 1918 newspapers? Come on, hands up. Thank you, David. Well, tell us about them, David. What took you to reading 1918 newspapers?
Well, it's because I've been interested in the 1918 pandemic, of course.
Okay. Okay.
There's an enormous amount that you can gather from the newspapers that goes above and beyond the scientific stuff,
Yep.
which I also read. But the newspapers give you the experience of living through something this horrible. The statistics don't tell what it's like to be in a community where people are dying and people are getting sick.
Yep, and they do and they don't, and I think that's part of the discovery, and that's why I also want to push you to help think with us as we deal with the issues that David's talking about, the universal influenza vaccine. How would we develop policies around a pandemic? What were the necessary or unnecessary steps? And then to think about that in the context, and I will get onto the talk in a minute, of us being at war at a time when massive immigration, massive disruption of social assumptions, tremendous change in terms of where people were living and why they did or did not understand the place they were living in. And also one shout out to David Christie, sitting in the back now. Thank you for coming over, David. David is the member of the yacht club who supported us being here tonight. So I wanted to say that. So this is the event expressed in one way, the largest change in life expectancy in our century. The drop of almost 10 years in a short time, right around the end of 1918, 1919, a famous graph from John Barry's book. These are some of the examples that I've pulled out of the out of the press so far through March, and I'll give you the address, and you can go back and look through that. Literally every morning into your email, into your Twitter account, whatever social media you want, I send you a article describing what has happened on that day in 1918. By this stage, how many people know any of the history of 1918 flu? John does, Alwyn. So about half of us, maybe. I am not going to be telling you about that, so you're going to have to bear with me here. At this stage, some of the histories say that on March 4th, the first case at Camp Funston. Does anyone know the state that Camp Funston is in? Kansas. Okay. We are not in Kansas, but yeah, importantly, it's in Kansas, and it's important from a One Health perspective because of the nature of what was going on in Kansas, the nature of the agriculture, the nature of the troop movements, the nature of the sanitation systems that were available. Up to March 4th, though, there are a number of other things going on in the United States, and I'll try and fill in some of those, and then we'll try and draw out what I'm calling our adjacent possibles. The concept that we have a history, but what if we'd done things just slightly differently? What if we had earlier on provided more information about the extent of the outbreak? What if earlier on we had not passed certain laws? What are those adjacent possibles? So when we get to the discussion period, start thinking about what are the adjacent possibles in your practice, in your sense of perhaps the flu that we've had in the last year, or the other outbreaks that you've been involved in. One day at a time is the name of the project. Take with the assumption that newspapers are that first draft of history. We can tell things from what is published, what isn't published, why there are a concentration of things, how the media itself is formed up, why we're getting more stories from New York than we are from Topeka, Kansas, why certain newspapers are more important than others, and also why certain ways in which we describe things are more or less important. We'll talk a little bit about how slow burning this pandemic was, what was available and what wasn't. What's the mix of war, health, and patriotism? The military camps themselves are important to describe. They're no longer really visible to us. There are some public history projects in New Mexico in particular that are trying to recover these towns who were really towns. 50,000 people lived outside of Deming, New Mexico for more than a year. The evidence of them having lived there is really not available. The buildings were all temporary, and then the sanatorium that came out of those buildings itself was lost to history when it was burnt in 1943. And then probably what's more important to us today is what are the public health measures? What are the public health measures taken then, and how have they changed, and how would we apply them today? We were at war. April of 1917, the United States having resisted going to war, and President Wilson actually having campaigned that he would not take the United States into war, we did declare war on Germany. At that time, we had a much lower life expectancy than we assume today. The number of reports on the sexually transmitted diseases amongst the troops was actually in some ways more significant in those early months than any of the reports of infectious diseases, other types of infectious diseases. The reason that those were being reported was sort of this shaming of young American men unfit to go to war to fight the battles, largely as a result of their moral failures of being infected with STDs. For the most part, the military medicine system was able to deal with those STDs. That, though, coming at the same time as an epidemic they really couldn't understand quite so well, and certainly not that I don't know any of us, when we even look back with an understanding of history, could have understood the size of this. We were largely an agrarian country as well. More than 50% of us lived in small villages, not even in towns. And the public health measures that we now can assume had their other challenges. The municipal water systems were not there for most people, and the dental and the vaccination and screenings were not universally available either. In that early few months, though, this is something we pulled out on January 6th, 1918. The city manager reports from Albuquerque, New Mexico, that there have been 0 communicable deaths in the city. Unlikely, they might not have been able to count them, but that was what the report said. And importantly, there's no smallpox. Smallpox being a normal and usual circulating disease at the time. New Mexico was just 6 years old as a state at that time, so really had no public health system to talk about. And yet, as we will see, within a system that had no public health system, within a state with no public health system, we were going to send 50,000 young men and have them live in close proximity with all sorts of structured and unstructured ways in which we were expecting to change the behaviors of 20-year-old men. And I don't know, there aren't too many 20-year-old men around here, but that's not really a normal target of intervention, successful intervention, I might say. In Arizona, pulling out another of the logs here, this one from February 8th. The use of the French term for influenza, grippe or grippe. Who wants to beat me up for my French accent can talk to me later. It's still widely used. They sort of used interchangeably, but again, if you dig deeper into the discussion here, sometimes they're thought to be different diseases, sometimes they're not. And remember, at the time, we still were not subtyping influenza. We didn't have the science to take that out as a virus. This phrase I certainly have enjoyed using because I think we understand, those of us that have had the flu, that it's, as you can read there, that a disease that makes you truly hate yourself. That sense of being controlled and not feeling like there's any way to recover from it. So as we talk about the slow burn, one way to capture how dramatic the first draft of history was in comparison to the outbreak is to look at the number of references there are to influenza. It's not until August that there are more than about 1% of the total references to influenza in the database I've been using. The database is the Library of Congress's Chronicling America website. And this is an electronic database of newspapers from the entire United States from, I think, 1690 to 1963. So if you ever want to do any kind of historical timeline research, this is a great place to start. But over the 2 years, less than 1% of the articles. So there was really no focus on influenza for a large amount of the time that we know it was circulating. And there are different reasons than just lack of understanding. There was the formation of the capital that was the underwriting of the newspapers. There were laws about free expression, all of the things that I'm about to discuss. But keep that in mind, and maybe think about that also as the inverse of the prior the prior graph I shared. To some extent, the lack of information might be driving the extent of which we saw the death. So this mix of war, health, and patriotism. As soon as we entered the war, we passed Espionage Act of 1917. This explicitly prohibits any interference with the draft. Well, do you think an interference with the draft would be saying, don't turn up at Camp Funston, you're going to get pneumonia, you're going to get your civil rights taken away, you won't be drinking beer, the town will be off limits to you, and oh, by the way, you're going to be involved in the greatest death event in American history. Perhaps that would be interpreted, and certainly was. There were plenty of people who were incarcerated under this act. It was added to with another act in 1918, May of 1918, where further extension of suppression of free speech with this language that to utter, print, write, or publish any disloyal, profane, scurrilous, or abusive language about the United States was the basis for your civil rights. And this wouldn't actually be repealed for 2 more years. I don't know anyone else's reading of the Constitution would suggest that this is a normal time in the United States, but it's certainly not mine. So this is the environment in which we are drawing out historical lessons from the newspapers as they were published in 1918. A few quick quotes for those of you that don't remember who was there and what sort of understanding there was. This was not necessarily a popular war, although certainly it was portrayed in a popular way. More than 15% of the United States population at the time had direct descendants from Germany, either their mother or father, they themselves were from Germany. So you couldn't even assume which side of the war your sympathies might have been just for your ethnic background. I'm not going to read these, so I'll just leave them up there for a second or two. The underlying part of it, though, is that the war was an entire focus for certainly for the newspapers, but also I think for many of the ways in which people lived their lives. So in that we had the suppression of news, but we also had the newspapers playing a function in terms of bringing the nation together to fight this war, to push more young men into fighting, push more of the women into supporting the war, either through work that was now opening up in some of the factories and some of the other roles. We do have to hold these two contradictory ideas together. And Scott Fitzgerald's description, is a good one. There was also a complexity. This was not an out-and-out propagandist press by any means. That the newspapers don't read as we would today, but there was a sophisticated nature the expectation of me just telling you things was not inherent in the way that the press was managed. The Committee on Public Information actually was a government-sponsored and government-underwritten additional capacity that the federal government used to supplement what the private newspapers used. This fellow in the bottom right is a guy called George Creel. He was Wilson's campaign manager. He's not quite the Steve Bannon of his era, but in perhaps no way like Bannon. He thought he was, and would continue to in his book, How We Advertised America, he was using the tools of patriotism in his vernacular to ensure that the American people were best informed about the things that they believed they were doing, fighting for the freedom of all individuals around the nation, around the world. The Russian Revolution was going on. The taking back the freedoms that had existed and liberties that had been expressed in the French and German governments, particularly in the 19th century, that seemed to be threatened by the anti-democratic Kaiser-led German government. These were not simple, direct America-only expressions. This was a very sophisticated, commercially oriented additional news service. There were 75,000 employees. Like I say, they were under this desire to put more expression out, more news, not less. There was a recruitment of people for Minutemen. No chuckles. There weren't many anyway, but maybe. Okay, thank you, David. The 4 Minutemen were recruited by the Committee on Public Information to stand up and take less time than I have already, ahead of the movie, to tell about certain patriotic and government-inspired themes. Everything from why the war stamps, why the bonds, why all of the other activities were going on. But this was an all of government, all of communication system that was parallel to an existing very rich media environment. The military camps have already addressed, already suggested that they were important. They were important in the history written, the official, I guess the official history. What are the, David? What are the? I mean, John Barry's sort of done the big task, the big lift for the rest of us.
What are what, the books?
Well, I would say his book isn't the official history, but it's sort of it's the touch point.
History is Edwin Oakes Jordan book in 1927.
But for those of us further away from the event, Barry has done the biggest and the sort of the most comprehensive.
Actually, Alfred Crosby.
Crosby's a good one too. I mean, Crosby's where we go back to the forgotten pandemic. But in Barry's book, he sort of pulls everything around this event in Camp Funston on March 4th, when the first cook from the camp reports to the hospital. And then from that builds out this massive event. These camps, as I point out in some of the locations, they're not in the major metropolitan areas. They are away from the main press. They're away from the big city and all its evils and STDs. And they draw in people from all over the nation, actually designed to bring people away from their homes, so they're trained in these locations, and you can see these are small and medium-sized towns. Often the camps themselves, 30 to 50,000, are larger than the location that they're in. So when you sort of see the sort of conditions we're setting up for the spread of disease, this is a key component of them. some of the reports that are already coming out early in the year are that there is a good amount of sickness. These camps were set up with huge hospitals. For 50,000 men, there would be hospitals of 2,000 beds. So different assumption about the size of and burden of disease in this group. More than 50% of the medical capacity of the United States was applied to supporting this troop training and the development of this system of training in the small towns across the United States. Within this is this report from the physician at Camp Cody, which is outside of Deming, New Mexico, that most of the sickness, not to do with any of the conditions in the camp, but it's these unhealthy recruits, these young men that came to the camp unhealthy, and all of the great medicine that they're receiving isn't the cause of this. Cases of pneumonia are just reported as if this is a normal and everyday, and the deaths are only from the untreatable ones. Nothing to see here. There's no problems here. Further on in the month of February, this is a report back to a Manchester, Iowa newspaper by another recruit, a captain who was at Cody as well, talking about the disease that he's just recovered from, and the fact that he's acknowledging the $16 that the Thursday afternoon card club has sent him to entertain the troops under his work. You have to remember at the time this war was funded not entirely, but largely by voluntary contributions of the population. We'd only had an income tax for less than 2 years at that time. So there was a massive effort to fund this through bonds, through stamps, and through other fundraising efforts, all voluntary. Into April, again, reports are coming out from the camps that we seem to get into an editorial issue here, because there's two, you won't see this necessarily, but there are two paragraphs here, the ones at the bottom, too small for people to read maybe, but the editor sort of went asleep on this one. The first paragraph reads, National Army camps continue with remarkably low rates. Very few new cases of measles and meningitis have occurred. These types of diseases are just normal throughout the entire time and throughout the entire literature. You just lived with measles and meningitis and things that some of us have seen, but many of us have not at this point. The next paragraph, National Army camps continue to have high sick rates compared with camps of other groups. Though the rates are lower than the last report, scattering cases of measles are reported from all camps. These reports may have been differently edited. The hard hand of the suppressive censor isn't there. Again, we're dealing with the first draft of history, but as you read more of the papers, and there are an enormous number, you begin to see there is an underlying sense that something's going on. Whether it's going to be fully expressed, you'll have to continue to read the blog. So, public health measures are normal and routine in this time and space as well. 1918 started with a tremendous set of, it was one of the coldest years in 50 years either side, tremendous series of storms on the East Coast. Coal wasn't able to move for more than a week out of Pittsburgh and out of parts of Pennsylvania. That was compounded with the fact that there were even there were measures to put coal only to the use of certain activities. Most of these were the industrial activities around supporting the war efforts. there were routine use of police powers in quarantines, though, that public health officers would use. Schools were closed. They were closed for fuel shortages as well as for scarlet fever and smallpox outbreaks. The entertainment systems were shut down. We were worried about the morality of a lot of the troops. This bled over to the camps not having the ability to go into town and watch the movies. So this was a thing that was debated back and forth often in these early months, because the difference between, we were talking about expression and suppression of media, keeps going back and forth. You know, a happy set of troops in the camps was better than one, but if they were going to become sick, that wasn't. So there was this sort of balance that kept on going on. There was a vaccination. It's called the Rosenau serum. This didn't come out till October, and there was no system for distribution. Within the military, there were certainly ways in which it might have been deployed, but by that time most of the boys were over in France, and it was less important necessarily to find this distribution there.
How effective was the serum?
Good question. I'm not sure if I got that here. I don't have that clip, but the best report, and it says it didn't kill anyone that didn't not take it. So it was not fully effective by any means. Its distribution in the middle of an event like this, and there certainly wasn't. Well, can I make the assumption, and I'd be happy to have people push back on this, I don't think there would have been either the scientific method or a way to determine effectiveness. Is that fair?
They didn't know about viruses. How did they develop a vaccine?
Well, so they didn't know about viruses, but they knew about all these diseases. I mean, so it's a good point. They could describe the disease, they could characterize it. You know, this discussion whether it's grip or it's influenza is a large part of the discussion. So observation was powerful, and there were a lot of people involved in the observation, including the press, including the military doctors. But I guess that's the difference. I don't know they could have proven effectiveness, but I think if there had been any demonstration of outcome, effect, whatever word we want to use, they certainly would have documented it, and they would have either continued to use it or not. Certainly there was understandings that the concept of infection was enough to close schools and things. Other thoughts on whether or not, what would have been the basis of determining whether a serum would have been effective or not?
Celebrity endorsement?
Celebrity endorsement, perhaps. What were you going to say, David?
Well, I was just going to say there were vaccines, not serums,
Right.
that were used, and they were effective, but they were not, you know, as has been said, the virus hadn't been isolated.
Right.
These were bacterial vaccines.
Right.
Because
Right.
almost everybody who died of influenza died of the secondary bacteria.
Right.
So they made vaccines against the bacteria, approved vaccines, and those vaccines worked. That's proven now statistically.
Okay. But at the time, were they in the position to prove that statistically and therefore develop a measures?
Statistically at the time,
Right.
we gathered the data that allows us
Right.
nowadays to prove
Right.
statistically.
Right. Yep. Just, you know, it's worth throwing out there. There were plenty of other understandings of what was implied by health, who would address it, the commercial provision of tonics, fill the newspapers. The newspapers have got are making plenty of money off of people providing grip, influenza, laxatives. Laxatives are a great boon to the newspapers. And depending upon which season, they take care of a lot of viruses. They seem to be much better against scarlet fever in the summer and against influenza in the winter. I read that as it was alcohol.
Material kind, and then it ends with frozen heads popping out of windows in the night.
When I read it, but then you're probably right that of the material kind seem to be coming into vogue again. Yes. The other interesting thing is the language is changed enough that bringing today's assumptions into that dialogue isn't always that successful. Here's the laxative. I don't know if this would have had much more effect, but certainly you had some other effects to take your mind off it, I suppose. From 1919, we talk about 1918 flu, but there's it's quite a long tail. These are some of the victims in the local press, Sunday newspaper. These are some physicians who died at Walter Reed. 5 out of the 10 people that had died that were from influenza. There are other observations later on. This is actually from a book that was sent from the United States to help the folks in Australia begin to put in some public health measures. You can see that there are expectations that there are ways that you can protect yourself. Oliver Wade's Spanish influenza are all about it. These are some of the public health protection notices that were offered as well, to the point that the vaccines were effective. Evidence accumulates that it is of considerable value as a preventive against pandemic influenza or against severer complications of the disease. We've got the classic commercial endorsement, but watch out for the countermeasures as well.
What inoculation?
These are some of the vaccinations that were being promulgated. So I didn't go in, and must admit that perhaps I should have done a couple of more slides on what the totality of this event was. I was assuming more people understood that. So we can explore that as well. But here are, to me, from 100 years later, some of the adjacent possibles that might have been an outcome. That vaccination would have offered the ability to have lower rates in the military. It was the one organized system. There was some effort to use blood transfusions to the extent that those might have additionally provided protection because of the number of antibodies. These were some of the things explored. Again, talking about adjacent possibles within the context of the understanding of the time. So this, I'm just hoping now we can have some discussion about what would have been possible. There were extensive use of police powers. David and I were talking about this. 10 years ago, I did a study with the National Sheriff's Association and with the National Association of City and County Health Officers. Less than 2% of that population had exercised their police powers together. And most of that had been on one person and that was a tuberculosis patient who had not been willing to go through the regimen. So back 100 years ago, the police and the public health system were the same thing. Their authorities were entirely joined up. So we live in a different era at that time. So the quarantining and the taking of people into different spaces would have been fairly simple. Perception is reality. We've described the fact that the epidemic takes off in a time when there was suppression, or there was different controls over the news media, but those also depended upon what perception of danger there was. In a time at which there was so much other infectious disease, why would this have grabbed your attention, particularly if you couldn't see it, given that the separation of these camps from the civilian population and lack of understanding? Then many articles say, yeah, this is going to be bad, but it's just like 1889. It'll go away, and a few old people will die. That isn't what happened. And that significant large shift of the death into the young people happened. Yes, Alwyn.
What was global mortality?
So global mortality is somewhere between 50 and 100 million during a war that took 27 million people. So it was happening at a time of great death, but because it happens outside of the focus, perhaps, of the news media, who know where a battle's going to happen, or they know they can get a good story from Captain Grossman. They weren't necessarily looking into these spaces. So that's the totality of what I've got. What are your concerns, questions, or adjacent possibles?